Hello everyone. Good evening. Can you all hear me? Good evening,
Yes, sir.
everyone. Yeah, all right. If you can hear me, good afternoon. Happy Sunday. Welcome to another or our first official session for this quarter. And we'll be starting shortly. Well, before we go ahead and start today's meeting, right? I don't know if it's possible. Our numbers on the group is not quite encouraging. So please, can we have mentees just go to their subgroups and also try to like maybe put a call through or send reminders that class has already started or is already in session, so that we can have more people joining. Is that fine? All right. I trust you all can hear me. Right. So we'll just be going into the business of today. Right. So we'll be taking announcements. Right. And our first announcement for today is that registration is still ongoing. Right. If you have friends and family who are interested in taking the JIIPCC course, right, you can tell them to register. We'll be taking in mentees up to the second week. That is by the end of next week, or this coming week rather. We'll no longer be taking any more mentees. So please, you can still encourage your friends to still register, right? And would make sure to add them to the program. Our programs are available for mentorship and intellectual properties, artificial intelligence and technology, the energy industry, fintech industry, health tech and law, because we are currently having patent drafting, blockchain NFTs and metaverse, data privacy and protection, entertainment business and law, and alternative dispute resolution. Right. So if you have friends or family who are interested or who will be interested in the program, you can do well to also share our flyer with them. Going into the business of today, our mentor for today is our one and only, none other than Mr. Ebenezer Iguatu. Mr. Ebenezer is not here with us, but I'm sure he'll be joining us shortly. Mr. Ebenezer C. Egwatu is a legal practitioner, medical law consultant, certified mediator, a trained legislative drafter, and a passionate patient rights and safety advocate. He is a principal partner, Law Founds Multidisciplinary Consult, a firm that provides innovative legal solutions located in Abuja, Federal Capital Territory, Nigeria. He is also the founder of and executive director of Lawyers Arise for the People Initiative, LAPI, a patient rights and safety advocacy NGO. Ebenezer is a trained medical care assessor with International Medical Law Center, St. Kitts, North America. He is a member of the Nigerian Bar Association, member Medical Law Professionals Association of Nigeria, member Institute of Medical and Health Law, member Bioethics Society of Nigeria, member Patient Safety Africa, member World Association of Medical Law rather, and member Association of Legislative Drafters and Advocacy Practitioners. He currently serves as the chairman, Health and Medical Law Committee, Nigerian Bar Association, Gariki Branch, Abuja, the Public Relations Officer, Institute of Medical and Health Law, and the legal team lead for Make Our Hospital Work campaign, a citizen-led community-based advocacy to improve the quality of healthcare service in hospitals and primary health facilities across Nigeria. He trains doctors, nurses, and healthcare professionals on promoting patients' rights and avoiding medical negligence. He is an avid reader, a researcher, and loves to serve God by serving humanity. That is our mentor for today, Mr. Ebenezer Egwatu. I'm sure Mr. Ebenezer will be joining us soon. Um, Mr. Ebenezer will be joining us soon, but while we wait for him to join in for today's session, we'll just kindly like to have, let's say we should have presentations first. And if I think I can see our presenter is already on call. we'll be taking the presentations first. So please, if you are available, good presenter, please go ahead and start the presentation while we wait for our mentor to join in. Thank you.
All right, good afternoon, everybody.
Yes, good afternoon.
Can you all hear me?
We can hear you clear and fine.
All right, so I'll go right into the presentation, and I hope it's okay to share my screen.
Yes, please go ahead and share your screen.
All right. Mm. Okay. All right, so today's topic is on health technology law, medical ethics, regulation, and compliance in the private health sector. Then we have our table of contents. We're going to delve into the introduction, health technology laws, medical ethics, the existence of and regulation of medical ethics in Nigeria, compliance with and application of medical ethics in the private health sector, relationship between medical ethics and medical malpractice, and then finally we have our recommendations. I hope you all can still hear me.
Yes, we can still hear you.
All right. So we stated the definition of um health technology by the World Health Organization, application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures, and systems developed to solve a health problem and improve quality of life. And this definition was adopted by the International Network of Agencies for Health Technology Assessments. Um, so technology is the practical application of knowledge, and health technology is the practical application of knowledge to improve or maintain individual and population health. So we're going to look at the definition of terms, and we started by defining health technology. And in the different scenarios where applies to, it applies in the prevention and rehabilitation interventions. It can apply to systems within which health is protected and maintained. It applies to procedures, medicines, medical devices. So the health technology law is the body of laws and regulations governing the design, development, operation, and use of health technologies. Then we define ethics. Okay, the right choices of conduct, considering all the circumstances. And we went ahead to define medical ethics as being concerned with the obligations of the doctors and hospitals to the patients, along with other health professionals and society. So these ethics and regulations play a vital role in medical practice in Nigeria, and they serve as a guideline that healthcare professionals ought to adhere to. Um, okay, we while disease outbreaks and other acute public health risks are often unpredictable and require a range of responses, the International Health Regulations 2005 provide an overarching legal framework that defines countries' rights and obligations. So they define the rights across borders. So it's an international regulation. The existing health regulations are an instrument of national laws that are legally binding on medical and dental practitioners in Nigeria. They also outline the criteria for determining whether or not a particular event constitutes a public health emergency of international concern. Um, so some of the examples of the existing health regulations in Nigeria: North Health not tech, health tech. We're talking of health regulations as it is. So, National Health Act 2014, National Health Insurance Scheme. We have the Food and Drug Administration Control. We have Basic Healthcare Provision Fund, and so on. So, health technology, also known as health tech, refers to the use of technology to improve the delivery, efficiency, and quality of healthcare services. We've already stated this before that they include software, medical devices, information systems, and so forth. In Nigeria, the recognition and adoption of health technology have been growing steadily in recent years. The Nigerian government and various stakeholders in the healthcare sector have increasingly acknowledged the importance of leveraging technology to address the country's healthcare challenges, which include limited access to quality healthcare services, inadequate infrastructure, and inefficient healthcare delivery systems. Recognition of health technology in Nigeria. In Nigeria, there has been a growing recognition of health tech. The startups have also been increasing in recent 8 years. Some of these health technology in Nigeria include telemedicine, electronic health records, medical devices and diagnostics, and as I mentioned earlier, health tech startups. So we're going to look at telemedicine. Um, Telemedicine platforms and mobile health apps have gained popularity, especially in rural areas where access to healthcare facilities is limited. So we have cases where people use their mobile health apps to keep track of their medications and have access to doctors without having to physically go to a hospital. Then we have the electronic health records, where recent uh, developments have included hospitals keeping the health records of their patients on the laptops, and this increases the ease of access to the health records. Then we have medical devices and diagnostics and health tech startups. They have brought innovation and entrepreneurship to the healthcare sector. These startups are developing and they're developing innovative solutions to address various healthcare challenges, including telemedicine, health insurance, medical supply chain management, and health education. So, health technology is undoubtedly used in Nigeria. Yeah, and some of these health, okay, we've mentioned this before. However, there is no legislation that specifically regulates the use of health technology across all medical fields in Nigeria. The different healthcare areas just have their own set of guidelines, like the National Health Act, Medical and Dental Practitioners Act, you have the Pharmacists Council of Nigeria Act, and the NHA, that's the National Health Act, protects patients' data privacy and gives patients the right to easy accessibility of their medical records. I think this is the most, these outlined acts are literally what we have closest to having regulations that help the health tech laws in Nigeria, because there is no actual law that guides health technology. So Section 27, 28, and 29 of the NHA went ahead to provide circumstances under which this right to privacy can be dispensed of. Then we have the National Data Protection Regulation 2019. And this regulation applies to both to Nigerian citizens who are domiciled in both Nigeria and abroad. From the regulations background, the regulation has the aim to protect the personal data of Nigerian citizens and residents. From the foregoing, health records classify as part of personal data, meaning that such data must be processed in accordance with a specific, legitimate, and lawful purpose consented to by the data subject, that's the patient. And this is subject to Article 4 of the National Data Protection Regulation. It further classified health data as sensitive information which has to be dealt with the consent of the patient. Then Section 37 of the CFRN, that's Constitution of the Federal Republic of Nigeria, provides that privacy of citizens' medical records cannot be dealt with without their consent or as prescribed by law. Then we have the Cybercrimes Prevention and Prohibitions Act 2015. We also have the National Health Insurance Scheme Act 2022, and they both protect the citizens' medical record from unlawful intrusion. Then would see that the word ethics is coming from the word ethos, meaning way of living. Then medical ethics deals with the distinction between what is considered right or wrong at a given time and the way functions are carried out in the medical field and the obligations of the doctors and the hospital to the patients along with other health professionals and society. Then ethics are okay. We've mentioned this before that they play a very vital role in the integrity in ensuring integrity and quality of medical service in Nigeria. So these medical ethics literally serve as a guideline to healthcare professionals. So okay, hospitals also ensure that their employees abide by the medical ethics, prevents litigations, which can cause loss of resources to health facilities. So we're going to look at regulation of medical ethics in Nigeria. Mm. Offices in Nigeria have enacted legislations and subsidiary legislations to regulate the conduct and decisions of medical practitioners. These regulations ensure that medical practitioners have a set standard of conduct to abide by, and they also ultimately promote public trust and confidence in the health sector, and this further promotes public health. Um, Okay, so we've looked at the NHA. Now we're going to look at Medical and Dental Practitioners Act, which establishes the Medical and Dental Council of Nigeria and saddles it with the responsibility of regulating medical and dental practice in Nigeria. And by Section 1, Sub 1 of the Medical and Dental Practitioners Act 2004, they are given the power to ensure professional discipline by taking punitive measures on those who breach those standards. And Section 1 Sub 1 gives them the power to make the code of medical ethics. So the Medical and Dental Practitioners Act is a mere regulatory framework of the medical and dental professions in Nigeria. And they have made a code of medical ethics. um, okay, so it was established by Medical and Dental Council of Nigeria to guide the behavior of medical practitioners when interacting with their patients, colleagues, teachers, the corporate body of the profession, and the general public. The code provides that practitioners' primary duty is to promote the health of their patients and respect their dignity. And this code lays down clinical ethics, which um, include providing appropriate privacy to patients, instruction not to smoke in the clinic except in the coffee room, expressing appropriate empathy to patients, protecting themselves from harm from patients, and to prevent um, allegations of impropriety, maybe a doctor-patient relationship, a doctor-doctor relationship in the workplace. And this code provides on the issue of informed consent, termination of services by patients, telemedicine, and assisted conception and related practices. Okay, it lays down guidelines to malpractice, improper relationships, and so on. All medical doctors are expected to familiarize themselves with these provisions. And other general codes that regulates the medical ethics include the Hippocratic Oath and physician's oath, which medical practitioners swear upon their induction into the profession. By these oaths, doctors swear to preserve life and not do anything to harm it. So, application of medical ethics in private sector. Medical ethics are fully applicable in the private sector as in the public health sector in Nigeria. In Nigeria, medical ethics are often guided by international standards as well as local regulations and guidelines established by medical associations and regulatory bodies. While adherence to medical ethics is essential, there are challenges such as resource constraints, cultural differences, and varying interpretations of ethical principles. Let's not forget that Nigeria is a country that has many um religions. So there is also the factor of religious constraints in effectively carrying out the medical requirements of by a medical practitioner. However, efforts are made by healthcare professionals and institutions in Nigeria to uphold medical ethics and ensure delivery of ethical healthcare services to patients. The Code of Medical Ethics 2008 applies to medical and dental practitioners in Nigeria, regardless of whether or not they work in the public sector. So this is a solid proof that these ethics also apply in the private health sector because they are all encompassing. Then we look at the extent of application. So awareness and education, the level of awareness and education among healthcare professionals influences their application in Nigerian hospitals. So hospitals should prioritize ongoing training and education on ethical principles because it tends to have better adherence. Then we have the regulatory framework. So the practice of these frameworks and guidelines that emphasize medical ethics. Okay, they emphasize that medical ethics can significantly impact their application. So when the medical profession has these guidelines and standards, it regulates their activities, thereby implementing the application of these frameworks. They have the cultural and religious context. Cultural and religious beliefs play a significant role in healthcare decision making in Nigeria. And medical ethics need to be contextualized within the cultural and religious norms of population served by the hospitals. Then we have the resource constraints. So Nigerian hospitals, like many healthcare institutions globally, often face resource constraints. These limitations can sometimes affect the application of certain ethical principles, such as equitable distribution of resources or access to healthcare. So the resource constraint has to be the most or if not one of the most factors that influences the extent of application of medical ethics in Nigeria. Then we have enforcement mechanisms. So the presence of these mechanisms, such as ethical review boards or disciplinary committees, can influence the extent to which medical ethics are upheld within hospitals. And while these ethics are fundamental to healthcare practice in Nigeria, challenges such as we have reviewed can also impact their consistent application. However, efforts are continually being made to raise awareness, provide education, and strengthen regulatory frameworks to enhance the application of medical ethics across Nigerian hospitals. So these factors that we've looked at affect the extent of application of medical ethics in Nigeria, but they are not limited to just these five factors that we've mentioned. So we're going to look at the relationship between medical ethics and medical malpractice. Medical ethics is an applied branch of ethics which analyzes the practice of clinical medicine and related scientific research. And it is based on a set of values that professionals can refer to in the case of any confusion or conflict. While medical malpractice is a legal cause of action that occurs when a medical or healthcare professional, through a negligence act or omission, deviates from standards laid down by the medical ethics in their profession, thereby causing injury or death to a patient. So we listed them in points. The first is ethical principle. So medical ethics and medical malpractice are related through the ethical standards that direct healthcare professionals. Ethical principles such as beneficence, non-malfeasance, autonomy, and justice form the foundation of medical ethics. When these principles are violated, it can lead to medical malpractice. And malpractice occurs when a healthcare professional deviates from the accepted standard of care. So ethical lapses such as a breach of patient confidentiality, or failure to obtain informed consent can contribute to malpractice claims. To have a standard of care, when it comes to standard of care under medical ethics and medical malpractice, it is the heart of a provider's ethical duty to their patients. That is the standard of care. The standard of care is a legal concept that serves as a good tool to help check if the physician provided medical care that a reasonable person would exercise under the circumstances. So medical malpractice cases often hinge on whether or not healthcare professionals deviated from the required standard of care which a medical practitioner is expected to have towards their patients. Then we have ethical communication between providers and patients. That is the informed consent. So healthcare providers have a duty to disclose the nature of a procedure, related risks, and possible complications. While there are exceptions, such as emergency situations, informed consent is a necessary aspect of a trusting relationship between a patient and the healthcare provider. And the patient's understanding of this information is measured against both a reasonable physician standard and a reasonable patient standard. So we have the human error and medical mistakes as well, where when medical errors happen, they can be classified as human error, which is often unavoidable to some degree and may or may not be legally actionable depending on the level of harm incurred. While not an ethical failing, if a healthcare provider becomes aware of a failure, they face an ethical dilemma to disclose or not to disclose. So, despite the potential legal consequences, they have to disclose this error that has come to their awareness. So, provide so far as that it is in their awareness, they have the duty to disclose such errors.
Um,
Um,
is our presenter, please, can you begin to round up? Thank you.
I'll just go straight to the recommendations because I think everything here has already been talked about. So, okay, the question lies on whether these existing legislations are sufficient to regulate the use of health technology in Nigeria. By carefully going through these information legislations, we see that they have not actually hit the actual issue, that is the regulation of the use of technology in the healthcare sector. These questions that arise are: what are the limits to the use of technology in healthcare? What are the liabilities for its misuse? What exactly are the requirements for waiving the right to data privacy? And to what extent can these rights be waived? So you can see that the laws that we already mentioned, they leave so much to be desired because it covers a very limited um, range of regulation over health technology service providers, and they're insufficient to control the interplay between sorry, health technology. Okay, sorry, why is this thing coming out here? And the importance of making legislation cannot be overemphasized in Nigeria because the sharing of medical information across the jurisdiction with the use of technology portrays the need to control breaches associated with digital space. So it is important that medical practitioners and stakeholders in the healthcare sector get familiar with existing health regulations in order to promote efficiency and development. Also, specific regulations are needed in new concepts and high technology innovations, such as surrogacy, organ donation, telemedicine, and their disciplinary institutions need more lawyers to ensure that these regulations are upheld. In line with this, ethics committees should be established within private healthcare facilities to provide guidance on ethical issues, review complex cases, and ensure adherence to ethical standards. So, all right, we've already talked about the importance of having guidelines. Furthermore, the benefits of transparency and accountability cannot be overemphasized. Um, Evaluation of ethical practices within private healthcare settings, seeking feedback from patients and staff, implementation of measures for continuous improvements in ethical decision making and patient care should be a continuous developing system. And by prioritizing medical ethics in the private health sector, Nigeria can enhance patient trust, improve healthcare outcomes, and so on. So we come to the end of this presentation with these points. Thank you.
All right, thank you very much, our group presenter, for that wonderful presentation. I think Mr. Ebenezer's network is having a little bit of network issue, a little bit of issues, but I'm sure he'll be joining us again very soon. I want to say well done to all Group 1 members that were able to put in the effort and make the presentation. Right, well done to Group 2, well done, and I want to also say well done to the group presenter. For Group 1 who were not able to make their presentation, please, I want to kindly employ you. Right. So if you have Group 1 members that are here, please, starting from next or this coming week, as we send in the topic for this week's task, please, presentations are a very important part of our discourse, and we cannot necessarily have sessions without presentation. So please, whatever the case may be, please, we can all work together to make sure that our presentations are ready. I can see Mr. Ebenezer is back with us. Thank you, sir, for joining in. Thank you for being here. We really appreciate everything that you do for us. Mr. Ebenezer has been a long-term member, not just member, but a long-term mentor on this program, and he has helped mentor several students within the health tech and law group. So I'm sure we'll be receiving quite a lot in terms of his experience and expertise on today's topic. And we'd just like to have Mr. Ebenezer come and give us his discourse on today's topic, as well as feedback on the presentations that was made by the mentees. You're welcome, Mr. Ebenezer.
Good evening. Can anyone hear me?
Good evening, sir. We can hear you, sir.
Good evening. Please pardon, my video is not on. I'm battling with network, so I don't want whatever will further affect the network. Okay, let me firstly welcome this set of mentees to JIIPCC and congratulate you for taking this bold step to enroll for this program. By the end of the training, you would understand how much good you have done to yourself by the knowledge you would have acquired or gained through this program. So congratulations. My name is Ebenezer Egwatu, as rightly been said. Firstly, I want to say that I've gone through, not all, I've gone through some of the slides, and I want to say that the slides are too many. Think about 50 of it, and you have limited time to present. When you are doing presentations of this nature, you just bullet points, not lengthy explanation. As you can see, you didn't have time to go through all the slides. So for subsequent classes, your slides should be maximum of 15, and that includes your recommendation and the reference, maximum of 15 slides, maximum. This is 50. Even in conferences, nobody does this. So, but I understand the passion. So that is that. What are we discussing? Health technology, medical ethics, regulation and compliance in the private sector. What about the public or government sector? So, what is health technology? Your slide adequately captured the WHO definition, so I will spare us with that. No need of rehashing or repeating it. Then health technology law is also captured in your slide. But I want to talk about medical ethics and bring it home so that it doesn't sound far or it doesn't sound highfalutin. Medical ethics, in a layman's language, is simply a professional code of ethics that regulates the conduct of medical or healthcare professionals towards their patients in the course of carrying out their duty, in the course of, how do I put it now? In the course of providing care for the patients. Now, you will get to know that the different disciplines that make up the healthcare profession have their different code of professional ethics or code of conduct. Can anyone hear me? Please confirm.
Yes, sir. We can hear you, sir.
Hello?
We can hear you, sir.
Am I talking to myself?
Yes, sir. I said we can hear you, sir.
Can anyone hear me?
I said, yes, sir.
Hello?
We can hear you. Hear you, sir.
Okay, awesome. So, the nurses, what did you say? Okay, so the nurses have their code of professional ethics. Same is applicable to doctors, the code of medical ethics. The pharmacists have their own. So the different disciplines that make up the healthcare profession, you know, the mistake people make is when we talk healthcare, the focus is on doctors and most times nurses. But there are other support disciplines, very, very key for us to have a holistic health care service delivery system. The anesthesiologists are part of the healthcare system. The laboratory scientists are part of the healthcare system. And they all, or the healthcare profession, let me put it that way. So I'm using healthcare profession. I didn't say medical profession. So you discover that they all have their code of professional ethics. But when we now focus on medical and dental, we are talking about doctors. So get that distinction. Now, what are these medical ethics? Strictly speaking, what do they contain? It is basically how the doctor should treat his patients, how the doctor should attend to his patients, how the doctor should relate with his professional colleagues, how the doctor or healthcare provider should relate with his office, how the healthcare provider should relate with the profession. If you have the opportunity of looking at the nursing code of ethics, you'll discover that it has like 7 groupings: the nurse and the community, the nurse and the nursing profession, the nurse and the patients, and all that, and all that, and all that. So the same way it is applicable to the healthcare profession, the medical profession. Now, if we want to talk about health technology, we will say that in Nigeria, health technology is relatively new. It is not new, relatively, because if you check the Code of Medical Ethics, I think in section 22, talks about, let me confirm, that's section 22 or section 21, talks about telemedicine. And as at that time, telemedicine was not being practiced anywhere in Nigeria as at the time. So you see that the drafters of the Code of Medical Ethics were like looking into the future or borrowing from what was obtainable in other climes. But today, we have telemedicine in full practice in Nigeria. And what is telemedicine? It is basically the provision of medical services through telecommunication, tele and medicine. So it is online prescription, online diagnosis, online treatments of patients using technology. meaning that you can be in your house, the comfort of your home, and get diagnosed, and prescription will be made, and you get the medications, and you are treated. Now, in going through your material, you cited that telemedicine is rampant in remote villages where there are no physical medicine, where there are no physical hospitals. In Nigeria, that is not the case, because the issue of network is there, the issue of even the rural dwellers to access phone that has internet facility is a challenge. The medicine practice in Nigeria is hovering within the cities, not in the rural communities, because there is a serious challenge, infrastructural challenge. By that I mean power, internet access, and all that. So what we have in those rural communities are, in some areas, primary health care centers. Where there are not, we have the queues, the trained health officers who go into those rural communities for vaccination purposes and just take care of them and come out. So get that impression corrected. Now, what are the advantages of telemedicine? It has its advantages, and it also has its enormous disadvantages. One of the advantages of telemedicine is speed, that the patient is attended to speedily, unlike where the patient goes to hospital to queue up to get a card and all that. Once you make your subscription, the way it operates is a platform like a mobile app is built. Doctors, the person who hosts the mobile app may not even be a medical personnel. It could be an entrepreneur who builds a medical app for telemedicine purposes, get doctors to subscribe. Maybe you have a consultant gynecologist, maybe they might have 2 or 3 subscribed. They might have cardiologists, people who see issues of the heart, subscribe. They might have nephrologists, they might have pediatricians. Get doctors from different specialized areas of medicine subscribe, such that when a patient has issue or a challenge, as you log in to make your complaint or request for service, once the issue you say it has to do with your heart or whatever, they channel you, they connect you with the doctor, the cardiologist, and he takes over from there, ask you questions, and begins to make prescriptions. So there is speed in being attended to. However, one of the major disadvantages of telemedicine, secondly, it is faster in saving life, because you can have, it's still the same thing, you can have quicker access to health, to a healthcare professional. Unlike if you are in one state and you want to drive to another state to go to the particular hospital that could attend to your case, or even within this, when you are within the same state, but the distance where you can drive 30 to 40 minutes before you could get to the hospital to be attended to. So telemedicine knocks this off. However, there is a challenge. One of the cardinal principles in medical practice is that you must observe and touch your patients before prescription. You must observe. There are some tiny details, not even tiny. A lot of details are missed out at the examination stage due to distance. So it is a major disadvantage in telemedicine. When you are saying, okay, if you recall, there are times you have been to hospital the doctor will open your eyes, check under to see the coloration. From your phone, the doctor might not see what he wants to see. Yes, he can tell you through a video call, open your eyes, okay, okay. He might tell you to press your neck or press your chest. Is it paining you? He can ask you those questions over the phone, yes. But it is not the same as he is looking at it. If it is maybe discoloration of the skin, you know there are some phones you might use, it won't give you the exact color. Not that there will be drastic difference or sharp difference, no. But what I'm saying that physical examination has been taken over. So the proper thing to do is, after the emergency attendance or attending to you, the doctor needs to refer you to the closest healthcare professional.
Mr. Ebenezer, sir, are you with us, sir?
Can you hear me? Hello? Hello? What?
Yeah, we can hear you, sir.
Okay. I thought you said something.
We can hear you, sir.
Okay, okay. So apart from that, there are other numerous challenges with telemedicine or health technology. You talk about data protection. Yes, you mentioned it. When you talk about data protection, you discover that even even under the medical code of ethics or code of medical ethics, practitioners are warned who want to delve into telemedicine that they should take up steps to ensure that the data of their patients is adequately protected, because information sent via the internet can be intercepted. So that is another challenge. Data protection, where the healthcare professionals, it could be through fax, it could be through email, but there is an exchange of data. So additional responsibility is cast on the person providing this care to take steps to ensure that the data of his or her patients is adequately protected. Okay, let me read section 22 of the Code of Medical Ethics, which provides for telemedicine. Say, telemedicine is a professional opportunity outcome of modern advances in computer and telecommunication technology. Is steadily creeping into professional practice in Nigeria. It is medicine requested and practiced at a distance, and it is particularly useful for patient care and management by general practitioners and specialists in assessing telesupport in their daily practices on the basis of requirements for specialist consultation in various specialties of medicine and dentistry. It is of ethical significance. Take notes. It is of ethical significance for registered practitioners to continuously assess and avoid medical legal pitfalls in areas such as confidentiality, professional competence, legal and registration status of the specialist being consulted, equipment reliability, sustainable continuity of patient management, and the timely referral of patients. I just told you that after consultation online, the healthcare provider is supposed to refer the patient, and that is what this is emphasizing again. Now, here is the responsibility I mentioned: electronic processing. Practitioners must make appropriate arrangements for the security of personal information when it is stored, sent, or received by fax, computer, email, or other electronic means Information must be kept secure before connecting to a network. You should ensure that data sent cannot be intercepted or seen by anyone other than the intended recipients. Practitioners should, however, be aware that information sent by email through the internet may be intercepted. That's one of the challenges. Data protection issues. Number two, which is a major challenge, is the licensing of the healthcare professionals who are the qualifications of the healthcare professionals who are providing these services. Now, even in where we have physical healthcare facilities, we have had cases of quackery or people who are not medical doctors impersonating and parading themselves as one. So it becomes a huge challenge because persons who are not qualified to practice medicine can hide behind the phone to provide medical services as professionals. Now, note that even those who are qualified, you pay your practicing fee for every year. One. Now, if you are moving from one level to another, you have to have taken the qualifying exams that moves you maybe to a consultancy cadre. Somebody who is not a consultant might be parading himself as one and be practicing behind the phone. Because if the person comes out, he can easily be caught. But if I don't say, my name is Dr. XYZ, I hold so and so qualification, you are not seeing me. You can't even identify me. Okay, except maybe where there's a video call. And is it sufficient evidence to verify my qualification? Excuse me. That becomes another challenge of telemedicine. Then we talk about compliance or regulation before compliance. When we talk about regulation of medical practice, you go to the Establishment Act first. So you talk about the Medical and Dental Practitioners Act, which is the principal act establishing for the practice of medicine in Nigeria. Then you talk about the Code of Medical Ethics, which regulates medical doctors. But that is not all there is to regulation. There are different laws. You have the National Health Act, which you rightly mentioned in your presentation. But I noticed a mistake. I think in slide 12 of your presentation, where you listed some regulations. Number 2, National Health Insurance Scheme is no longer known by that. Since 2022, we now have the National Health Insurance Authority Act 2022, which repealed the National Health Insurance Scheme. Please take note of that correction. Hello, can anyone hear me?
Yes, sir, we can hear you, sir.
Yes, sir.
Okay. So we now have National Health Insurance Authority Scheme replacing the National Health Act, replacing the National Health Insurance Scheme. So we have the National Health Insurance Authority Act 2022. Take note of that. When you talk about the Basic Healthcare Provision Fund, it's not really an act per se. This is a provision under Section 11 of the National Health Act, which provides that a percentage of the budget should be designated for basic health care. And then that provision divides or provides what that fund should be used for and how that fund should be raised. Those who can contribute to the fund. Then part of what the fund should be used for is that 5% of it should be used for health emergencies in hospitals. Unfortunately, that has not been the case. The last time the former Minister of Health said he used the Basic Healthcare Provision Fund to buy ambulances. So the Basic Healthcare Provision Fund is not a regulation per se. It is a provision under the National Health Act. Section 11 of the National Health Act makes that provision for Basic Healthcare Provision Fund. So take note of that. All these service scheme now, midwife service scheme, no, they are not regulations. They are not. So you talk about the code of conduct of the different disciplines, different healthcare disciplines. The Pharmaceutical Society of Nigeria, the code of conduct. You talk about the code of medical ethics. You talk about the nursing code of conduct, their professional code of conduct. You talk about that of anesthesiologist. You talk about that of maybe laboratory scientists and all that. The things that guide their professional conduct. Then the National Health Act regulates medical practice in Nigeria. So the National Health Act it is an act of the federal government or an act of the federal legislature that regulates how medicine, medical practice, that regulates healthcare service delivery better. So because it goes beyond the rights of the patient, it goes beyond medical ethics and provides even setting up necessary committees, providing procedures, licensing of hospitals, whether it is supposed to be a tertiary hospital, whether it is supposed to be a secondary healthcare facility, whether it's supposed to be private. So those provisions are made, even up to procedure for organ donation. All of them are contained in the National Health Act. So National Health Act is the principal healthcare service delivery regulatory documents or instruments that we have at the moment. So there are other subsidiary legislations that are as a result of the National Health Act. So we look at compliance. We look at compliance. When you talk about compliance, okay, still under regulation, the Medical and Dental Council of Nigeria is there. Now, the Medical and Dental Council of Nigeria, beyond regulating doctors, note, the Medical and Dental Council does not regulate hospitals. No, they do not regulate nurses. Nurses are regulated by the Nursing and Midwifery Council of Nigeria. The Medical and Dental Council is only for doctors. So the erring doctors can be reported to Medical and Dental Council for appropriate disciplinary measure. But beyond that, the Medical and Dental Council regulates the contents
Hello, sir. Can you hear us?
Hello? Can you hear me now? Sorry, my network logged me out. I am back.
Oh,
Can you hear me
we are
now?
welcome. Yeah, we can hear you, sir.
Hello?
We can hear you, sir. We can
hear
Okay,
you, sir.
awesome. So, the Medical and Dental Council regulates the curriculum development for medical schools. So, they check the contents of the body of knowledge that will be taught to medical schools. So, apart from it is only the disciplinary, their tribunal, they have a disciplinary committee, after which if there is an erring doctor, you report the doctor to the committee looks into it. If there is merit in your case, a disciplinary tribunal is set up and the doctor is tried at the tribunal, and punishment, would I call it punishment, sanction will be awarded. His name could be struck off the list, the register of doctors in the country. He could be suspended from practice for a number of years and later reinstated. So we talk about compliance with medical ethics in private sector. Like I said earlier, is it only in private sector that compliance should be? There should be general compliance. However, there is a challenge. Firstly, you need to know that the NMA, Nigerian Medical Association, they have some committees. One of such committees is one that's more like anti-quackery, that goes after quack doctors to ensure that quackery is reduced. They have a task force committee, and part of their responsibility is to ensure compliance. But when it comes to private hospitals or private health sector, it is a bit challenging in the sense that, how do I put it now? Firstly, I do not know whether we have a directory. Ordinarily, it is supposed to be. So having a directory of all healthcare, private health or private hospitals in Nigeria. So the standard thing is that there is supposed to be, because for you to be licensed to float up, have a private hospital, you are supposed to have gone through the necessary procedures, meet the government requirements. In fact, under the National Health Act, even there is a committee that is supposed to come and inspect your premises where you are setting up, to say, okay, this place is good, we approve of it, then set up. So where the challenge is with compliance, firstly, is that a lot of patients are ignorant of their rights. Now, there is this Messiah syndrome challenge with doctors, some, not all of them. To a reasonable extent, doctors are saviors. They save lives. So they now have this Messiah complex that your life is in my hand. Now, under paternalistic theory of medical practice, by that we mean the doctor takes all the decision that he knows that is in the best interest of the patient. That used to be the order of affairs in time past, but it's no longer so. Now we are now looking at patient's autonomy, where the patient has a right over his body. Under the paternalistic era, the patient has no say. The doctor does whatever he thinks is right in the best interest of the patient. If the doctor wants, he can amputate the patient's leg at will, because that's what he feels is the best for the patient. But under patient's autonomy, the patient has a say. The patient has a right to determine whether he wants his or her legs amputated. Now, that is where the dilemma comes in. A lot of patients do not know that they have these rights. Because they don't know what their rights are, they do not even know when these rights are abused. And even if they get to know when these rights are abused, because of that fear of the doctor, they don't know where to make the complaints. They don't know how to make the complaints. And sometimes our culture of God gives and God takes, just let it slide. There is no adequate reportage of, okay, let me not put it this, there is no adequate complaints on issues of patients' rights violation. So to reason to that extent, you might not be able to determine the extent of non-compliance. However, the cases we read every day, those that make it to the news, now show us that there is no sufficient compliance with the code of, with regulation generally, medical ethics regulation. There's no low level of compliance with medical ethics and the regulation. Now, what is the way forward, or what could be the issues that gave rise to this low level of compliance? One is monitoring. Even if there is a monitoring team, do they have adequate funding to go around the country and monitor? One. Two, personnel. Does the NMA have sufficient personnel to go around the country and monitor? Does the Medical and Dental Council have sufficient personnel? If they have the personnel, do they have the funding? That's on one side. Then on the converse, the patients themselves are not reporting, like I said earlier, where there are challenges. So thirdly, is this issue of, even though it rarely plays at the Medical and Dental Council, I can tell you that one free of charge. I have had the privilege of observing proceedings of doctors, professors of medicine, standing before the disciplinary committee or the disciplinary tribunal. So I have been privileged to observe their proceedings, and I can tell you ahead of time, they do not take it lightly with any doctor who is reported and the doctor is found wanting. The appropriate sanction is usually meted out. So those are the challenges we have with compliance that constrain in fact, the size of our country. But technology, we can leverage on technology to do a lot of things. Firstly, by sensitizing the patients on their rights. Once we have that massive campaign, massive awareness campaign, we sensitize the patients on the procedure to lay their complaints. Once patients begin to complain, because you need to understand that compliance with medical ethics, failure to do that can result in death of the patients. As little as telling a patient that he or she has a right to refuse treatment. If you force the treatment on the patient, no matter how best you are, no matter how good your intention for the patient is, you're already breaching the right of the patient to refuse treatments. With time, we will get to look at patients' rights and what they are. Then you will better understand this aspect of today's topic. So, in summary, healthcare technology has come to stay and can only get better. There is a video I will send to the group much later. Just watch it. There are robots that are carrying out surgery. We are talking about telemedicine here. The world has gone far beyond telemedicine. In your last set, I sent a video. In Ghana here, they are using drone to deliver drugs, healthcare products. They are using drone. This person is in this city. They need this healthcare product in the other city. There's a company in Ghana. They are using drone to deliver healthcare medication. So that is health technology. I am not aware of that's happening in Nigeria yet, but we will guess. That's the best way you can describe it. Last year, there's a conference I participated in. The theme was bloodless surgery. That's where the world is getting to, where you can be operated upon and there will be no need of blood. There will be no need for blood. Now, it is technology that is pushing that. Remember here, for now, if someone is going to the hospital for surgery, for any procedure, they will tell you to donate blood. If you are not donating, you are buying 2-3 pints of blood. But the world is already talking about bloodless surgery, where there will be no need for that. That is technology. So we will get to that level as a nation. We are far behind, we must acknowledge. However, we are making progress, though at a very slow pace. As for medical ethics, the compliance, we cannot ascertain percentage-wise due to improper documentation. One, then we do not have negligence as a result of non-compliance with healthcare ethics. We cannot say 20%, 30%, 50% due to lack of data. The same thing has to do with the regulation. For regulation, there are laws on ground. There are policies, but the level of compliance will show if there is drastic reduction in the effect of non-compliance. So the more we see effects of non-compliance, which sometimes is just worsening situation of the patient's health and all that, the more we are seeing that it shows that the level of compliance is in. I'll be willing to take them. Hello, are there questions?
Okay. Thank you so much, Mr. Ebenezer. To our mentees, do we have questions? Right. Are there questions that we want to ask? Mr. Ebenezer is available to take our questions and also answer them. Right. So do we have questions? Questions from the research you made as a group. Are there questions? Please, I also like to employ or call on our mentees to turn on their videos so that we can also know that they're in session and they're paying attention. And also, please, just if you would do that for us, it will be really appreciated. Right, please, we'd like to have mentees turn on their videos.
No, you are not begging. Hello, Dennis, please
yes, sir,
correct that impression. It is not an appeal. They are not doing you any favor. That has been the standard. So let them know. In fact, I said I didn't have time to join your onboarding session, so I didn't know how it went. I wanted to add some ground rules. Maybe in our next class, we will get that when my video will be on. So go ahead.
All right, thank you very much, sir. Please, if you can just turn on your video so that we can see you. And questions, we are taking questions. Please, we are taking questions. If you have
Hello,
questions,
mentees. Yes, we are taking questions. Turn on your videos. Then in our next class, when my own video will be on, we will introduce ourselves properly. Today, I'm just seeing your faces, but in our next class, I'll have you introduce yourselves.
All right, so do we have questions? Please go ahead and ask your questions so that we can get on with today's session. I'm sure from everything Mr. Ebenezer said, there are a few questions that may want to come up or that you may have. So please go ahead and ask those questions. Is there any area he pointed out to that there's not so much clarity? Mr. Ebenezer talked about ethics and compliance and the regulations that we have on ground. Have you noticed or witnessed any form of non-compliance within the medical sector, and you would like to maybe have some clarity on that? Please go ahead and ask questions.
If there is no question, I will presume that they understood my explanation. That will be my presumption. So we can move ahead. Okay. Who is grace of God? And Rachel.
It's me.
Rachel, can you hear us? Please, if you can, we will also like to see your face. We'd like to also see you turn on your video. And also, grace of God, please, you can turn on your video.
So,
okay, I think Mr. Ebenezer is still having a little bit of network issue, but I'm sure he'll be joining us back very soon. But please, I would like to employ every session that we have with our mentees is one where we hope to have an interactive session. Some of the informations that are coming from Mr. Ebenezer are coming from not just from a academic point of view, but also from an experience-based point of view, right? So please, we like to also, we want to have a form of dialogue in this session so that we can also get to learn more. Your questions will prompt him to go deeper into aspects of the profession of the healthcare, of health tech law practice, right? That you may not necessarily come across in textbook-like formats. His professionalism is what is going to bring out the answers to those questions. So it's a core part of our practice to have questions in every session. So please, I would like to say maybe even if it's a question or two, so that we can all proceed and call the session to an end once we are done. So please, you can also put the question in chat box so that we can read that out to him and he can answer. So please, we're still taking questions. Okay, in the absence of any question, I would like to please also, okay, thank you for your question. Thank you, Grace of God, for your question. Once Mr. Ebenezer joins us back, I'll be directing your question directly to him. So, but before he does, right, um, I would like to still buttress on the point I earlier made about presentations, right? We have a few things that make up for each sessions, and you have the mentors presentation. We also have the mentees presentation. As much as we receive, our goal and our duty is to come and hear, or one of the things we come to do during session is to come and hear from our mentors. We also want to see the work done by the mentees in researching. So please, every time it's time for class, please, or before class, when a task is given, please do ensure to do due justice to the task so that we can have presentations during session. Mr. Ebenezer, you're welcome back. Thank you, sir, for joining us again. We have one particular question here, and I will
Okay.
just read you so that you can maybe help us with the answer to the question. The question is, which act protects the patients and doctors? Are there acts that protect patients and doctors?
The National Health Act provides for the rights of the patients. Now, for the patients, there are a lot of, when we do patients' rights, you will understand better. But the National Health Act provides for the rights of patients, some of their rights, not all. Firstly, you need to know that we do not have a single document that houses or has all the patient's rights in it, as it stands today in Nigeria. So the Patient's Bill of Rights, which is a policy document by the Federal Ministry of Health and the then Consumer Protection Council, which is now Federal Competition and Consumer Protection Commission. The Patient's Bill of Rights 2018 has about 11 or 12 rights of the patients. Some of those rights are also contained in the National Health Act. Then you now have the Compulsory Treatment and Care for Gun Wound Victims Act 2017. The Patient's Bill of Rights is 2014. The Compulsory Treatment and Care for Gun Wound Victims Act 2017 is a law that provides for the rights of victims of gunshots. So these are a special class of patients. Before then, if anybody suffered gunshots and goes to hospital for medication or treatment, the person is required by law to provide police reports. And that led to a lot of lives being lost. Because you can't see, but what it meant is that if a victim of gunshots came to the hospital, the doctor or nurse cannot treat the person until he brings police reports. So that led to the enactment of the Compulsory Treatment and Care for Gunshot Victims Act 2017. We also have the HIV/AIDS Anti-Discrimination Act 2014, which specifically provides for the rights of persons living with HIV/AIDS. So you see here, there, that's how. Then even under the Code of Medical Ethics, some patients' rights are the right to confidentiality, right to privacy are provided, even right to refuse treatment are all provided in the Code of Medical Ethics. Now, for the rights of doctors, some of them are provided for in the Code of Medical Ethics, what a doctor should do when a patient abuses that doctor. Then some of those rights are also provided for under the National Health Act. But you need to know this, that some of these patients' rights are also under the under Chapter 4 of the 1999 Constitution, which is fundamental human rights. So basically, a doctor is a human being, a Nigerian. Same with a patient. So where there is a violation of the rights of the doctor, as a human being, as a Nigerian, the doctor can go to court and file a suit under the fundamental, under Chapter 4, fundamental human rights, and get his redress. Do you understand it? So, but there is no single document now that we can say this is the Patients' Rights Act. We do not have it yet, but we are pushing for it. We are seriously pushing for it. And hopefully, in no distant future, we will have that, so that all the patients' rights will be consolidated in one document. But if you pick it, you know, this is patients' rights. So that is the patients' rights are derived from different sources, some international treaties like the Universal Declaration of Human Rights. Some rights are there, the African Charter, some rights are there, the Lisbon Declaration. When we do patients' rights, you know the sources and all that. So does that answer your question?
I'm sure it does. Grace, if you can hear us, does that answer your question, or is there more clarity that you will need on as regards that particular question? Grace of God, please, can you hear us? Can you confirm that that's Mr. Ebenezer's explanation answered your question? Okay, I don't know why we can't hear from her. Maybe maybe he or she is having network issue. But we'll still go on. We are still taking questions, and I think I would also like to put out a question, sir. Right?
Okay.
Are there like enforcement? What enforcement standards have been put in place to ensure that in the cases of non-compliance, right? What are some of the things that can, how I put it now, can come out of for the patient? If like a patient's right has been abused, what are some of those things that maybe the Nigerian government is doing to make sure that patients in itself adequate?
Okay. How do I put it now? You are asking basically redress mechanisms.
Yes, sir.
For the Compulsory Treatment and Care of Gun Wound Victims Act, there is a provision there that where somebody who has the responsibility of treating a patient refuses to carry out that responsibility, of treating a gun wound victim, refuses to carry out that responsibility, it was not even treating, of helping a gun wound victim, refuses to carry out that responsibility, that person is liable to a fine. Section 20 of the National Health Act provides that no patients, in fact, that hospitals should not deny patients treatment in emergency situation. That's talking about patients' right to treatment in emergency situation, not patients' right to free treatment. Patients' right to treatment in emergency. So the law says that hospitals should not deny patients treatment in emergency situation for any reason. So you have a situation where people go to hospital and the doctor says there is no bed, or the nurse says doctor is not on seat, or they say go and deposit money before we treat you. Now, those are abuses of the right of the patient. Now, section 2, subsection 2 of that section says that any healthcare professional, any person who is found liable, that's who violated section 1, will pay a fine of 100,000 naira or serve a jail term not exceeding 6 months or both. So what it means is that where a patient goes to hospital and that patient is denied treatment in emergency situation, the patient can sue the hospital, provided that the patient has sufficient evidence. With time, we'll also do evidence gathering so that you know how to prepare your case, because it is with evidence that the judge or the court can look into the matter and give judgment in your favor. Where there is no evidence, justice is denied. So those are the two examples. In fact, there's a provision in the compulsory treatment and care of gun wound victims, up to 500,000 naira fine can be awarded up to 5 years imprisonment can be served, or 5 years jail can be served. So, but the challenge is, do the patients know these rights? They don't. They don't. So the laws are there. Now, even corporate organizations for gun wound victim, now, ordinarily, when somebody dies, there will be no compensation before now. But the law has made provision for compensation. The High Court can now determine what is adequate compensation to the family of the deceased. But the Nigerians know these laws. That's the question. They don't. So does that answer your question, sir? So
Sorry,
what did
yes,
you
sir.
say?
Yes, sir. Yes, sir, you've answered my question. Thank you very much, sir.
Okay,
all
someone
right.
is saying, let them get the last act. Compulsory care, compulsory treatment and care for gun wound victims Act 2017. Compulsory treatment and care for victims of gunshots Act 2017. Did you hear that?
Sir, we did. I don't know if the person also did. Grace, Grace of God, please confirm if you heard me say.
Someone posted on the group, he said, please, I should mention, please, the last act you mentioned, I didn't get it. I'm saying the act is Compulsory Treatment and Care for Victims of Gunshots Act 2017.
Thank you very much, sir, for also pointing that out and giving answer to that person. In the absence of any questions, please, again, I'll still want to call for our mentees to turn on their videos so that we can have our picture time and we can, I think we are set to close this. So can our mentees turn on their videos so that we can have our picture? Can we have mentees turn on their videos? I can't see mentees responding.
Okay, so
Ebenezer's video is on. Please, can we have more mentees turn on their videos? Thank you. Thank you. All right, we're done with that. Thank you very much. Thank you, everyone, for complying.
okay.
So with that, we've come to the end of today's session. Mr. Ebenezer, I want to say a very big thank you.
Since the videos are on, before we go, can everyone introduce herself? Why do you have only female in this set, Dennis? What happened?
I think we have a few male. We still have a few male.
Okay, there's a guy, I think Joseph, what's his name? There's a young man I sent the link to. I hope he registered. So can you introduce yourself, your name, if you're a student, the course you're studying and your university? Okay, your name, your state, where you are located, where you are joining us from, how you got to hear about JIIPCC, and what interested you in choosing medical and health law. So let's do that quickly.
Good evening.
Please.
Okay, Uju, you can start.
Okay, someone is starting, or should I continue?
Okay, go ahead. Go ahead. Richard, go ahead.
Yes, I'm sorry. I had an emergency and it's still on. That's why I'm just off and
just speak up.
Yes, I said I had an emergency. That was why I was just off and on. But my name is Tari Wario.
Sorry about that.
Yes, Max Alagua. But I'm not a student. I heard about it through someone, but I can't remember. Can you hear me? Can you hear me?
Yes.
Okay, I got to know about this group through a colleague. I'm a lawyer, yes, but I wanted to know more because I'm one of the legal practitioners in Federal Medical Center, Yenego, and I needed to know, like, for
Oh,
knowledge
great,
sake,
great,
to know
great.
more.
You are in the
So that
legal
was why I had to.
department.
Yes, sir. Yes, sir. The legal unit in
Awesome.
admit. Yes, sir. So, and it
Okay,
has been one
if that is
wonderful.
the case, I'm going to introduce you to our institute,
Wow, thank
Institute
God.
of Medical and Health Law.
Beautiful, sir. I
To
appreciate it, sir.
introduce you to our institute so that you come and be trained properly.
Yes, I really want
Your
that.
capacity will be built to do what you're doing.
Yes,
so
sir. I would appreciate it, sir. Yes, so that's why I had to come in, and my group, they've been wonderful, as in, and very patient.
Introduce you to the institute.
Yes. Yes.
So that if once we are having our trainings, I will get you linked up so that you get trained, then be a member of the institute.
Okay, thank you so much, sir. Yes, so that's how I got in.
Did you do medical law anywhere along the line before now?
No, I didn't.
Wow.
I didn't. So that's why I'm like, okay, anywhere I can find it, let me just see how I can get involved and be part of it.
Okay. Welcome on board. Glad to have you.
Thank you so much, sir. I would appreciate it.
By the time we are
done, I will, sir.
You will have an idea of what medical is.
Yes, an idea.
I also train hospitals. So
wow,
if your hospital wants, we can come and train you. Yes. I train doctors, I train nurses on medical and health care, on medical negligence, avoidance of medical negligence. Because for us, we think prevention is better than
prevention is
cure.
better. Prevention
Others
is better.
might wait, okay, let the damage happen, then we go to
Before
court and make
we
money.
go to court. And that's very wrong.
So let the damage happen. But the challenge here is that the damage is a damage to human life.
Yes,
it's not damage
we
to
witness
car.
it a lot.
It's not damage to chair.
No,
it's not.
No.
You understand it?
Yes, sir.
So
yes, sir.
For us, we felt, okay, medical law, patient's rights awareness is, in fact, this week, awesome. This week, from 15th to 19th of March of every year, is World Patient Safety Week. You
see?
This week we are in already. It's World Patient Safety Week.
Okay.
Last year, every since 2019, 2020, 17th of September of every year is World Patient Safety Day.
Okay.
So you discover that patient safety is a global concern.
Very much.
And you know that the awareness is coming up in Nigeria. Last year, I led the MBA Garki branch. I happen to be the chairman of the Medical and Health Law Committee of Garki branch of the MBA.
Of Garki branch.
So, yeah. So I led the MBA, the entire branch, to mark the World Patient Safety Day. And then on the 18th, I joined the Federal Ministry of Health to mark World Patient Safety Day. Now, why I'm saying this to you is that patients' rights and safety awareness is growing in Nigeria. And one successful patient negligence case can shut down a hospital.
Very well, sir. Very true. Very
There's a
true.
case in Ebonyi State. The government, the court awarded 50 million naira against the hospital. So if 3, 4, 5 patients
would do that,
get 50 million naira damages
each.
From
that's
what I said,
that's the end of the hospital.
So I'm saying if 5 patients get 50 million damages against, please let me turn on the generator. Get 50 million damages against hospitals. Will that hospital survive it?
No, sir. No, sir.
So that is why we are doing what we are doing.
Okay, sir.
Okay. Ebenezer will soon be shortly with us. I still want to
turn on the generator. Hang on.
All right, sir. I still want to also ask our other mentees to turn on their videos, please, so that we can have our introduction. we can properly introduce ourselves. We can get to know you, know what you're doing, whether if you're a student or you are actually practicing, right? So please go ahead and turn on your video.
Okay, so let's have the next person. Richard, let's talk after now so that I
Okay,
don't
sir.
lose the class time too.
Yes, sir. Yes, sir.
Let's have the next person.
Okay, we would like to have Oluwa Juwonle Wale. Sorry if I didn't pronounce your name very well. Sorry about that.
Good evening, everyone. My name
Good
is
evening.
Awe
Good
Oluwaju.
evening. Okay.
Yes, I'm a law student at
Where
Redeemers
are you
University.
joining us from?
I'm at Ede Osun
You said?
State University. Osun State in
Your
Redeemers
line is
University.
breaking. Okay, Osun State. Are
Yes,
you
sir.
hello?
Hello, sir. I can hear you now.
I said, are you a law student?
Yes, I'm a law student, sir.
Which university?
Redeemers University.
Okay, awesome, awesome, awesome. Welcome. What level are you?
I'm in 400 level.
400 level. Do you have medical law in your school?
Yes,
as
sir.
a
I did.
course?
Yes, sir.
Okay, so you did medical law.
Yes, I did.
Okay, awesome. So why did you decide to join this class?
Sir, I developed interest in the field. Because it's something that people really don't know much about, especially patients, as you mentioned. Many of them don't know their rights. Many of them don't know about patient autonomy and these things, and patient bill of rights. These things are very important. So I'd like to develop in this field. Yes, sir.
Okay, okay. You're welcome.
Thank you, sir.
At the end of the training, I would like to have your honest feedback on the impact of the class on you, whether you gained knowledge, whether your perspective has changed, whether you can now take action, whether you even know your own rights and how to enforce it. Because charity has to begin at home. It has to start with you before it gets to other people. Next person, Uju, can you introduce yourself?
Okay, good evening, everyone. My name is Uju. I'm from Ekiti State University.
From where?
Yeah. Ekiti State University.
Okay, awesome. What level?
Yeah, 300. I'm a law student.
Okay, do you have medical law as a course in your school?
Yes, we do. But we study it in 500 level. So I just said to do the course.
So you are ahead of your people. Awesome.
Yes.
In our institute, we also have student membership level. So at the right time, if you are interested, you can join the institute as a student. It's going to give you a lot of advantage. So next person.
Thank you, sir.
Yes, Anosike.
Good evening, everybody.
Good evening.
My name is Olumachuku Anosike, and I study at Nnamdi Azikiwe University, Oka. I'm a 500 level law student.
Okay.
And I got to hear about the program. I didn't hear about it. I saw it on someone's status. So I decided to check it out, and I saw health tech law. And I've been wanting to do something on it for a very long time, considering I have a lot of medical doctors around me.
Oh, really? Yeah. Okay,
yes,
but
sir.
Do you have medical law in your school as a course?
No, we don't offer it as a course.
Okay. Okay, great. So next person.
Okay, please, who is here to introduce? Okay,
Sophia.
Grace. Okay, Sophia is a staff with JIIPCC, so she's
okay. Yes, awesome. So I will show you people next week. In our next class, I will start giving assignments. Like I said earlier, the presentation was too lengthy reduce your slides to 15. In the course of the class, I usually teach my students or mentees other position, principles of research, principles of internet, so that you know the relevance of. I noticed some of your documents, some of your facts you got from Wikipedia, but when we do our training on that, you will understand why you should use other sources than Wikipedia. So we'll have a wonderful evening rest. See you next week, Sunday.
Thank you so much, Mr. Ebenezer, and thanks to all our mentees who were able to make it for class. We would like to also encourage our mentees to follow Mr. Ebenezer on LinkedIn, right? You can also see some of the content he's putting out, and I'm sure you can also reach out to him. He's also a member of the class, so please, if you have any issue or any challenge that you would like,
yes, if you have your question after now, you can ask on the WhatsApp group. The class continues.
Yes,
if you stumble on anything, yes, I will also encourage you to follow the news. Anything you see on medical negligence, hospital did this, follow it so that you know what is happening. Thank you.
Yes, sir.
So
Thank
bye,
you,
everyone.
Yes, sir. We've come to the end of today's session. We've come to the end of today's class. Please, everyone, do have a lovely evening ahead and enjoy the rest of your night. Take care, everyone.